We're joined now by Dr. Jose Pereira, a leading authority on palliative care. He has spent years helping people die well. Dr. Pereira from Ottawa, thank you for being with us.
Thank you very much, Lorna, for the opportunity.
Now, you're concerned we put around a bigger understanding of how to discuss this issue. What are some of the big issues that we need to be looking at when we start to discuss physician-assisted suicide?
Well, my thoughts stem from my experience in Switzerland because I worked for about 3 years in Switzerland from the end of 2005 through to 2008, and in Switzerland physician-assisted suicide is allowed. And so during those 3 years it was an interesting, thought-provoking experience, and it shaped my thinking on the issue. When I asked myself, what are the lessons that I think I would bring back to Canada, now that I'm working in Canada again, in Ottawa, there are a few that jump out for me. And the first one is the importance of ensuring that there's excellent access to palliative care for anyone who has a progressive incurable illness. The second one is that a slippery slope does exist. And you'll often hear proponents of assisted suicide or euthanasia saying that research studies out of Oregon and out of the Netherlands, where assisted suicide or euthanasia are allowed, do not support the concept of a slippery slope. But I would argue that a slippery slope does exist, and we need to be aware of that. The third one, I think, is the importance of, if there's going to be a debate in the country about this, then we shouldn't call it the Death with Dignity Act or whatever it is. We should leave dignity out of it. And I can explain that a bit later. And the fourth one, which I think is extremely important, is that everyone, the whole society, is informed. And that is health professionals going through their medical school, nursing school, etc., but also the public is informed about the issue. It's a very emotional and divisive issue, and there are arguments on both sides of the coin, and we can get caught up in that. And I think it's important that when we do have a debate or dialogue about it, that we're pretty clear about what we're talking about.
Okay, because there has been a private member's bill entered on this which would encourage physician-assisted suicide in Canada. What is the slippery slope you have documented from your studies overseas, from looking into the situation in the Netherlands, in Oregon? What is the slippery slope Canadians should be aware of?
I think that's an extremely important question. If you look at the data across in those countries, in those jurisdictions that do allow assisted suicide and euthanasia, the data seems to indicate that there's been no dramatic increase in the number of cases of persons asking for assisted suicide or euthanasia and receiving it. And on the basis of that, they say there's no slippery slope. But let me share with you some experiences that I had in Switzerland. So Switzerland has got 26 cantons, the equivalent of our provinces. And in those 26 cantons, there are only a small handful of them where there are actual palliative care services in place. The rest, there's no formal palliative care services, at least not supported by the cantonal health ministries. And so, despite a large debate about assisted suicide, etc., they haven't put in place access to palliative care across all the jurisdictions. In Geneva itself, at the very time that the Hospital of Geneva, the large teaching academic hospital, opened up its doors to assisted suicide, they shut down the community-based palliative care service.
So it's the idea that if you tilt one way, you start to diminish services that were there for hospice and end-of-life palliative care.
Exactly, and then also the criteria starts changing. So for example, in Lausanne, where I practiced, there were criteria within the hospital. One of the criteria was that you had to have a progressive incurable illness in order to be considered for assisted suicide. And yet we used to see patients who had been considered that did not have a progressive incurable illness. And the right to assisted suicide organizations in Switzerland, Dignitas and Exit, when I left to come back, were making the case that assisted suicide should be allowed for anyone who wishes to end their life for whatever reason. And they were trying to make the case that elderly persons who felt that they had lived a full life and didn't want to live any further without having a progressive incurable illness should have access to assisted suicide. So in that, I do believe that there is a slippery slope. It was interesting, one of the first the reason why assisted suicide was first considered within the CHUV, the Centre Hospitalier Universitaire Vaudois, which is the main teaching hospital in Lausanne, was because an elderly gentleman with no family living on the 5th floor of a building that had no elevator ended up in hospital and had a very complicated course, was found to have metastatic or advanced lung cancer, and stayed in hospital. He couldn't go back home, was too weak to go back home. And after 2 months in hospital, he made the comment that, I wish I could just die. This is not a way of living, just living in a hospital. And on the basis of that, the discussion was opened up. And I feel that therein does lie a slippery slope, that in response to those type of requests, instead of saying, well, let's talk about assisted suicide, I think the question is, are there gaps in our social services that we need to address?
Why does this matter so much to you as a physician, Dr. Pereira?
Well, it matters to me because I'm involved in caring for persons who are dying. So it's got a direct impact on my work. As an individual and as a palliative care physician, I do not support assisted suicide or euthanasia. I try to understand where the request is coming from, and I recognize that there is significant suffering, and we need to address that suffering. I feel, though, that our response should be to improve palliative care, to improve on how we manage the suffering, whether it be physical, spiritual, psychological, social. I do not feel that the response is to hasten someone's life.
We started this discussion with you because as we looked earlier in our program at Protest, a large part of those people marching in Ottawa earlier this spring, end-of-life issues and sanctity over the end of life were part of those concerns. Mm-hmm. If protest is not the way to discuss this in Canada, what do you advise is the correct way forward on this?
Well, I think everyone shares a responsibility in making sure that everyone is informed, and I think programs like this, the media, share an enormous responsibility. For example, I think we've got to be very careful when we're talking about statistics. So in many countries, and in Canada as well, we'll often hear the statistics of, well, the majority of citizens feel that they have a right to access to assisted suicide or euthanasia based on some sample, some testing. And if you look at the questions that were asked, the question we asked were, they asked the people, would you choose between suffering or would you choose between ending your life with dignity through assisted suicide or euthanasia? And that's the wrong question. The question should be, if you had access to good palliative care, where we were able to try as best we can to alleviate as much of the suffering you have, would you choose between that or assisted suicide? And on the topic of dignity, I think one of the points I made is that I think we should avoid using that terminology, because in calling it, such as in Oregon, calling it the Death with Dignity Act, we are implying that you can only die with dignity if you die through assisted suicide or euthanasia, and I would disagree with that. Around the world, thousands of people die receiving very good palliative care in a very dignified way.
All right, so the protest you would have us see is to build up the end-of-life care, not hasten it.
Absolutely, and there's still, although in Canada we've made enormous strides in the last decade, thanks to many individuals across the country and many leaders. Senator Sharon Carstairs has been a wonderful champion for it, and it's caught the eye of many other countries around the world. We've done great advances, but there are still many gaps. And if we look around the country, there's still many gaps in services. There are many gaps in terms of at a primary level of care. In other words, family physicians, etc., being or having the capacity to provide palliative care at those levels as well. Shortages of hospice beds, for example, across the country. Enormous shortages. Even here in Ottawa, we have some shortages in hospice beds.
All right, Dr. Jose Pereira, thank you very much for being with us.
Thank you very much for the opportunity. Really appreciate it.